Hello, my name is Robert Boxler, and today I'm going to take you through Bloodborne Pathogens refresher training, another section of the overall safety training program with Akron Public Schools. This is a mandatory OSHA regulation that anyone that has the potential to be exposed to bloodborne pathogens gets a refresher once a year to go over the potential issues related to bloodborne pathogens. We want to make you aware of the hazards and instruct you on how to prevent exposure to those issues. Bloodborne pathogens are small organisms that infect and can be transmitted through blood and other body fluids. Typical examples are the hepatitis B virus and also the HIV virus. The hepatitis B virus is a viral infection of the liver. It's typically transmitted through exposure to infected blood and body fluids. Symptoms occur typically in 2 to 6 weeks, include flu-like stomach pain, jaundice. Some people, however, can be infected and do not show any symptoms at all. These people are typically considered to be carriers, but can still transmit the disease and be infectious. Vaccination may prevent infection. Hepatitis B is one of the few pathogens that does have a preventative vaccination possible. The HIV virus, the human immunodeficiency virus, also known as AIDS, can be transmitted through exposure to infected blood and body fluids. Symptoms may not occur until years after initial exposure. Infected persons who do not have AIDS but carry the HIV may still transmit the disease. There is still currently no vaccination for this. While all employees may be exposed to bloodborne pathogens, several employee groups that perform duties most likely to result in exposure include nurses, such as in our clinics, athletic coaches and assistants, custodians, and certain classes of teachers, such as science teachers that handle scalpels and glassware, our special ed teachers, MH, and teachers in those categories. Transmission: sexual contact, sharing of needles, contact with infected materials, with broken skin or mucous membranes, expectant mothers to their unborn children. These are all various methods of transmission of bloodborne pathogens. How do you control exposure? The common term is called universal precautions. What this means is that you are to treat all body fluids as if they are contaminated. This includes, but is not limited to, blood and urine and any other body fluid. You are to treat it as if it's contaminated at all times. So we're going to talk about protection such as gloves and safety glasses. An exposure control plan includes disposable gloves, eye and face protection, possibly getting into even protective clothing, and proper disposal. Exposure control plan: use of protective gloves when handling contaminated materials or doing any cleanup. All protective wear is to be disposed of after each use. Do not reuse it. All contaminated surfaces are to be cleaned within a 5-foot radius. Always wash your hands after removing your protective gloves. Flush any exposed cuts with water. Flush your eyes, nose, and mouth if they have been splashed. Do not eat, insert contact lenses, or apply makeup in areas where any exposure to bloodborne pathogens can occur. Handling the wastes. All items visibly contaminated with blood should be placed in trash cans or even possibly trash cans with biohazard bags. This includes towels used to clean up spilled blood, bandages, or other blood-soaked items. Biohazard containers consist of a covered trash can with a plastic orange biohazard liner. Now, these are not required in our school system. We do not fall under the hospital regulations. So all I would request is that if you end up handling blood-soaked items and put them in a trash bag, inform your custodian of this issue so that he can take that trash out of the classroom so that it does not remain there for the day, and replace your trash can liner with a clean trash can liner. Waste materials not normally considered infectious, including feminine hygiene products, soiled disposable diapers, tissues and towels used for personal hygiene, do not need to be put in biohazard bags. All containers used for disposal of these items should be in a lined can, however, with a plastic liner. Personnel are to observe universal precautions when removing liners from trash cans. All biohazard liners should be placed inside a regular trash liner prior to disposal, and then all waste should be placed in the dumpster. Under no circumstances should anyone go into a dumpster to retrieve any trash. The risk of puncturing your fingers with needles or blades or anything that could be covered with any potential bloodborne pathogen is too great. So if you lost something of value, going back into the dumpster is not advisable. These are typical hazards that you would see associated with biohazard containers and biohazard bags. Akron Public Schools employees do have access to the hepatitis B vaccination series. You can see here that it is recommended to new employees who have duties that may expose them to bloodborne pathogens, or employees who have occupational exposure to a bloodborne pathogen within 24 hours of that exposure, and medical evaluation and follow-ups after exposure to incidents. If you have questions regarding these issues with vaccination procedures and our health policy issues, please contact the Human Resources Department. This concludes the refresher of bloodborne pathogens. Thank you for your attention.